are now contemplating rationing care as the first shipments of the second approved vaccine, Moderna, start to arrive across the country today. Joining our conversation, Dr. Naheed Bhadelia, NBC News and MSNBC medical contributor, infectious disease physician, medical director of the Special Pathogens Unit at Boston Medical Center, and associate professor at Boston University School of Medicine. Dr. Bhadelia, the question I've been asking my team and my family all day is, how could this virus become more contagious? It's already, its most distinguishing characteristic is that it can take out a whole wedding. It can take down a whole restaurant. It could have, I mean, what does more contagious look like?
Yeah, Nicole, great question. And I think it's sort of important to note in general that every time a virus or bacteria goes from one host to another, it evolves ever so slightly, right? It mutates a little bit. That's why when we do disease investigations, we get to look back and say, how did this disease go from one person to another? So the troublesome thing is in this UK variant, what they're noticing is multiple mutations in the spike protein. That's part of the virus that it uses to enter the human cell. And the concern is, as you said, is that this strain is more transmissible. So what they mean by that is that, it can transmit with greater ease between people. And part of what they're basing that on is two things. One, they're noticing that it's becoming the predominant strain that they're seeing in a lot of new infections that are occurring, and they're seeing the number of infections that they have go up. However, that latter part could be just that people are letting their guard down. Potentially, there could be other explanations, but it's worrisome enough for them to sort of roll back that sort of the reopenings. What this says to me is, it really puts the importance of why we need to keep the number of new infections down, because every time this virus infects new people, it gets a chance to mutate. So if we keep all those non-pharmaceutical interventions like masking, like distancing, keep the number of people getting infected low, we keep giving the virus fewer chances to mutate. And again, it also makes it important that people get vaccinated as soon as possible, because that's the other way we reduce the virus from mutating.
So two questions. One, have there been any mutations that have not traveled around the world? And I ask that because we have not banned travelers from the UK to this country. It could be here any moment, right?
For all we know, Nicole, it might already be, right? So they've been seeing cases go up and travel has been open. That's why it's always a double-edged sword with these travel restrictions, because on the one hand, you think that you might reduce the number of people coming in, but the minute you put those travel restrictions in, people rush to travel somewhere, particularly on the holidays. Yeah. And that's what happened with the first restrictions as well. So the one thing I just want to go back and say is that even though we know that this could be a strain that's more transmissible, it doesn't tell us anything about its lethality. It doesn't tell us, again, it doesn't tell us, like, is it going to cause most severe disease? That hasn't been shown. It's not, something that's evidence. It's just that it's a bit more contagious than what we're seeing in other strains. There are probably multiple variants that are out there. To me, the importance of finding this strain is that we need to make sure that we're keeping our ears to the ground scientifically from the laboratory capacity to keep looking at the genetics of this virus to make sure that we pick up these mutations exactly for these public health reasons.
And just really quick, do the vaccines that have been approved in this country protect against this new strain of coronavirus?
Yeah, this is a concern for a lot of folks. So let me just start off by saying that, both the CDC and others have said that they're going to look into this, but they're not as concerned. And the reason why is because, Dr. Tom Frieden has used this example that these vaccines are kind of like an email that gives a photograph to your body so it can recognize a culprit and attack it, right? So if you change like one small detail in that photograph, your body's still going to recognize the virus. So the small mutations, number of mutations don't really matter. And so the vaccines are still likely to be effective. We really worry about over the years if tons of details change in that photo, tons of mutations occur, that the vaccine may not give the right instructions to the body. So right now that's not a concern, but it is something that we're looking into.
Dr. Naheed Bhadelia, you always have the answers to the questions that I've been grappling with for days now. Thank you so much for spending some time with us.